Okay. Hello, can everyone hear me? Just give us a thumbs up. Perfect. All right, so it's 6:30. Thank you so much for joining me tonight. I'm so happy to see so many people wanting to come and listen about our oral hygiene in our pets today. So welcome. This is AAPS's contribution to Pet Dental Health Awareness Month. And just in terms of some webinar housekeeping, this session is going to be recorded for all our everyone that can't attend tonight. So if you are uncomfortable being recorded, please don't hesitate to turn off your video. And I will be holding some time right at the end of the session for any questions that might pop up. If you do think of any questions as we're going through, you're more than welcome to pop them in the chat box so you don't forget the questions, and then I'll address them all at the end. So welcome again. Let's get started. Okay, so introduction, a little bit about me. Just like you can see, my name is Dr. Saruchi Pereira. I am not Megan. I have taken my boss's account, so to be able to hold this Zoom session. So I graduated in 2015. I am a vet, and like it says on the screen, I am a vet with a huge passion for dentistry. So for people that know me at the shelter, I am very lovingly known as the Crazy Tooth Lady. Just a quick introduction, because shamelessly I need to show everyone my gorgeous cat here as well. So this is my my cat Cleo. She's very lovingly called the Chimkin Lady, and she is the epitome of a comfy, pain-free cat. So when we're thinking about oral hygiene, my goal is for every animal, every patient out there to be pain-free like my cat here. So she is one of my drivers for wanting to spread my my knowledge, my education, help everyone gain a bit more knowledge about the importance of oral hygiene and, you know, what is actually dental disease that affects our patients. So just before we get into the nitty-gritty, a couple of disclaimers. So in terms of my qualification, I have done further study in veterinary dentistry. It gives me a qualification of a member. So a member is not a dental specialist. So I am not a dental specialist. I have done further study. There is only 2 registered specialists in Victoria, and I in no way, shape or form want to be trying to impersonate them. So I'm just hoping that the amount of knowledge that I've got is, I just want to be able to spread it to everyone. And I do believe that everything that I'm presenting today is backed by evidence, but obviously I guess there could be new research out there that I am not aware of yet. I have no financial conflicts of interest to declare, so that I will be showing some dental products during this presentation. I'm not sponsored by any of them. They're literally just my personal preference, and I personally feel like I have really good positive feedback around these products, and all these products shown are for educational purposes only, and they may not be suitable for every single patient. Let me just double check. Yep, perfect. Let's keep going. So today we're going to be talking about oral hygiene in our pets. So it's broken up into a few different sections. So firstly, I'll introduce you to what exactly is oral disease, and then specifically what is periodontal disease. They're 2 separate things. And then I'm going to go into an explanation of how oral hygiene goes to help with treatment and prevention of periodontal disease. And then as an example of some dental products and oral hygiene products, I'm going to be going through, both for cats and dogs, what we use at APS to help introduce our patients to different types of oral hygiene. And then I'll then go into some common myths and misconceptions that that do surround what type of oral hygiene is appropriate. There is a lot of misinformation, especially on the internet, about how you should or shouldn't help your pet's teeth. So hopefully I can bust a few myths there. And then the section I'm looking forward to the most is all of your questions. All right, so oral disease, what is it, and what specifically is periodontal disease? So oral disease literally is any sort of disease process that affects the mouth. It can be any degree of, something that you're born with, something that affects your bite, could be something wrong with your jaw. Oral disease is vast, but when we're talking about dental disease, as you may have heard from your vets or other people, you're talking about periodontal disease. So periodontal disease, if you break it down, if you can follow my mouse, peri means around or to the side, odont means tooth, and then disease. So we're talking specifically about a disease that affects around the tooth. So what exactly is it? So periodontal disease is a dental infection by plaque, which is layers and layers of bacteria. So bacteria are pretty much the furry feeling that you feel in your mouth when you don't brush your teeth. So if you stop brushing your teeth for a certain period of time, you can feel that there's something on them. That's plaque. It's not generally something you can see until it then calcifies and becomes tartar. So tartar is what you can see. That's calcified layers and layers of bacteria. So plaque is found mixed with, plaque is found with bacteria mixed with saliva, and it almost creates this slime layer. And I guess the really big important part of why we're talking about this is that the studies have shown that 80% of cats and dogs are affected by the age of 3. So that's a huge percentage of our patients being affected by this type of disease. So this periodontal disease is separated into 2 different stages. So the first stage is known as gingivitis. So that's when you've got inflammation of the gums, and then as the disease progresses, you then get something called periodontitis, which is inflammation of the bone and surrounding tissue. There is many factors that can impact whether or not plaque is going to continue to grow and cause disease. So you can have gingivitis that never progresses to periodontitis, but every time you have periodontitis, it's always preceded by gingivitis. So in terms of factors, it can, this is just layers of bacteria. So depending on, the host's immune response, so whether the patient can actually ward off the infection at the gum line, whether or not they've got any specific breed predisposition. So unfortunately, our smaller breed dogs tend to be more affected by it. That doesn't mean that our larger breed dogs won't be, but it is something that affects a lot of our smaller breed dogs. So I guess dogs and cats that are known as your squish-faced or your brachycephalic breeds, because of their teeth not aligning properly, that can also predispose them to developing, your plaque layer and your dental infection. So if you were to follow my mouse to the right here, I've got an image of what we're talking about. So grade 1, so for all our pet parents out there, you might hear your vet describing, you know, your pet has grade 1 dental disease, your pet has grade 2 dental disease. So this is a picture diagram of generally what they are seeing. So as you can see here, at grade 1, you've only got some gingivitis. So it's probably a bit hard to see, but you can sort of appreciate the gums are starting to become a bit red here. So all this yellowing is not where the infection is. The infection is at the gum line. So you have periodontal disease once it hits the gums. And as you can see here in this sort of picture diagram, it's at the gum margin here. So once your plaque infection, your bacteria continue to multiply and grow, they then continue to go deeper into the actual roots of the tooth. So this is the crown, so the part of the tooth you can see. So with this part here, and then this is the root, which you can't see. That's hidden by your gums up here. So when your infection progresses down here, that's when you have a progression of disease. You have that's when you start getting some bone loss and attachment loss, and that's where your pain really starts. So I guess this is a very, this is a painful condition. And I guess one thing to note here and something to keep in your mind is that gingivitis, so the first stage of periodontal disease, is reversible. So literally, if we can get to our patients at this point, stop that plaque from getting down into the gums, we can stop all the consequences that are, well, hopefully all the consequences associated with progression of periodontal disease. So I guess as periodontal disease progresses, you've got loss of bone, you've got exposure of roots, you can get infection of the pulp, and then eventually you get loss of the tooth. But I guess until they get to that loss of tooth, there is so many consequences that can happen that can cause a significant amount of pain in all of our pets. So we were just talking about consequences, so let's dive a little bit deeper into that. So first thing, like I was saying, chronic pain and inflammation. So when you've got inflamed gums, I guess if you're trying to think back to your own teeth, if you had a little bit of infection starting, what you'll notice is, you know, when you floss or when you brush your teeth, you have a little bit of bleeding, and you can just feel that tingling in your mouth, and that's just one little area. So most of the time when we see our pets in the clinic, it's generalized. So you've got generalized swelling of the inflammation of the gums, as well as that you've got chronic pain associated with that swelling. And then what can happen is when you've got continuous infection at this gum line, you've got a huge burden on your immune system. So the body is always trying to stop the dental infection from getting to the roots, because that's where all the pain starts and everything starts. So when you have chronic infection of the gums, you've got a huge burden on your immune system trying to continuously fight it off. You then, a lot of studies have shown that with stage 3 and 4 periodontal disease, there's increased risk of heart, liver, and kidney disease. So as well as it being a chronic source of inflammation, what can happen is that the bacteria that are present at that gum line can actually go into the body, travel down through the bloodstream. Well, I think theoretically that's what they say. They don't know for certain, but theoretically that's how it could potentially go and impact the heart, the liver, and the kidneys. It goes through the bloodstreams, attaches onto the heart or the liver, and can have significant sort of consequences in other organs. So you see a lot of your Cavaliers, your King Charles Cavaliers, they, because of the type of their mouth, they're predisposed to, you know, periodontal disease. They're also predisposed to heart disease. So I guess if there was any way that we could keep their teeth, in a good shape, at least we could help potentially reduce the risk of them developing heart disease, or even, I guess, reducing the progression of heart disease. It's studied enough, but it's something that's, I guess, so achievable in terms of keeping on top of their plaque infection, that if there was a way we could help reduce the incidence of heart disease, why not? But I digress. So I guess there has been some correlation between the chronic inflammation and oral tumors. So this is specifically in humans. It hasn't been studied that much in our cats and dogs. A bit like when you've got people that are affected with inflammatory bowel disease or irritable bowel syndrome, they're more likely to have rectal cancer and those sort of cancers. There has been similar correlations between this chronic inflammation that's affecting the mouth and developing oral cancers. There has been studies that report that, in cats, 10% of all tumors that are found in cats around that all happen in the mouth. In dogs, I'm pretty sure, if I remember my stats correctly, it's close to 4 to 5% of all tumors are based in the mouth. So, I mean, it's a huge portion of tumors that, may potentially be, reduced if the periodontal disease wasn't a risk factor. So these words here, so in terms of other consequences, we've got oronasal fistula. So oronasal fistula is something that happens on the top arcade here. So when you have severe bone loss, especially on the tends to affect the upper canine, but can happen with any of these teeth at the top here. What can happen is, as the bone recedes away, you can actually create a hole, a communication between the nose and the mouth. So your nose and your mouth is separated by the hard palate, the bone. Excuse me. And when you have chronic plaque infection eroding away at the bone, what you can have is, as that bone erodes away, you've got a hole, and through that hole, every time your pet eats, you could inhale some of that food, run the risk of inhaling and causing things like pneumonia. You can also have chronic nasal discharge, sneezing, and just quite an irritated area. If you have a hole that goes from your mouth to your nose, that's not going to be very comfortable at all. Bone infection, so that's actually separate to just bone being eroded away. Some of this plaque has been known to go and actually seed deep into the bone. And once it sort of sets deep into the bone, it can be quite difficult to try and get rid of. It might need very extensive surgeries. I have seen reported cases where a large portion of the bone of the jaw had to be actually surgically removed because you just couldn't get on top of the infection. Eye infection. So back to, if you were looking up here, you've got your roots of these teeth. So if you imagine this is the front of the dog's mouth, and this is the back, your eye is just up here. So you can have a condition called a retrobulbar abscess. So your infection can travel from these roots of these big teeth here and have what's called an infection brewing at the root of these teeth, and these infections can turn into almost like an abscess, a pus that puts pressure behind the eye, and in really, really severe cases can actually cause the eye to bulge. And in those cases, you can also run the risk of the patient losing their eye because of the severity of the infection behind the eye. So these, I'm talking about these consequences, and I guess one thing to note is that they're not uncommon consequences. This it happens, and it's not something that happens once in a blue moon. It's I wouldn't say it's very common, but it's something I would see on a day-to-day basis, having one of these consequences show up. Now, the last point here, severe bone loss resulting in jaw fractures. So this is generally sort of directed at our small breed dogs. So with your miniature breeds like your Chihuahua and your Yorkshire Terriers and your cats as well, the actual size of the tooth and your roots make up a huge portion of the actual length of the jaw. And so what happens is, if this infection is allowed to progress, you can have infection eroding away at the bone until it hits the bottom of the jaw, and any sort of pressure at the front of the mouth can result in the whole jaw just breaking off. And once it gets to that point, because the actual area is infected, trying to fix the jaw in an infected area can be quite difficult. And in sort of salvage procedures, I have read in the textbooks where some vet dentists have had to actually remove the front half or a quarter half of the jaw because of not being able to stabilize the joint. So not the joint, sorry, stabilize the bone. So it is quite serious, significant consequences if periodontal disease is left unchecked. So in terms of what can we do about it, let's get past all the serious stuff and start looking at what we can do to fix this. So I guess, at the end of the day, there is the main importance of oral hygiene is, number one, we want to remove or reduce the levels of plaque in the mouth. We reduce the levels of plaque, we significantly reduce the risk of all those consequences that we were talking about. And that can be done obviously with the pet doing something themselves, or could be something that we do for them. So, I mean, even if I can't convince you to brush your pet's teeth every day, if you were to start at least having a look inside their mouths, there's so many benefits to even working towards brushing their teeth. So the first one is increased awareness. So if you have a daily routine or every second day routine of opening the mouth and just having a look, you might actually notice something a lot sooner than their yearly annual vaccination. Because I would say with most clients that come in, it's not very often that you're actually coming in for a dental assessment or dental check. It's something that's checked during their yearly health check, and you go, oh dear, there's a lot of infection in there. And clients would be telling me that I have no idea. I had no idea that it was this bad. So that increased awareness means that we can actually get to any infection sooner, which means a lot better outcome for all of our patients. As well as that, the sort of second benefit from that is we're reducing the inflammation and pain. So the pain associated with gingivitis and periodontitis increases as it gets worse. So, when you've just got that little bit of gingivitis, it's not painful. So, if we were working on it before it gets painful, then we can remove all of that pain associated with those serious consequences. So this point here, increased bond between pet and parent, this is something that I talk about in all of my consults. So if you had the habit of brushing their brushing their coat, there's no reason why you brushing their teeth can't be a bonding activity. So for me, I'm brushing my dog's coat, I'm brushing her teeth. You know, it's something that we do together, and it's something that increases our bond. So it's, you know, there's so many benefits to looking at performing oral hygiene for our pets. It's an activity that you can do together, and it doesn't have to be a stressful experience. One thing to note, all dental pain needs to be removed before you start. So if you're, I guess, if you think about it, you know, you're worried that, oh no, I've learned that I've got potentially, you know, periodontal disease. I want to start brushing my my pet's teeth, but they haven't had a check in a very long time. I would be worried that there could already be a rotten tooth or something there causing a significant amount of pain, and you start brushing an already painful tooth. One, there's no amount of brushing that's going to get rid of the pain that's there. And two, you're going to create something called mouth aversion. So they're not going to want to have their mouths touched because it's already painful. And then once the pain's gone, they may already behaviorally hate the brush because they have already associated with the pain. So that's definitely something to keep in mind. When we're talking about oral hygiene, we always, I guess, it's been separated into two different categories. So you've got passive. I sort of just went over this. So passive is something that your pet does on their own so they have to chew to, I guess, remove the plaque levels or the plaque bacteria in their mouth. And then you've got the other category of oral hygiene, which is active. So that's when you're involved and you're doing something to remove the plaque in their mouth. So what the studies have shown is that active is a lot more effective at removing plaque than passive. So I guess it theoretically makes sense when you're actively brushing their teeth, you can target the areas that are causing issues, versus if they're passively just chewing, they may choose to chew in one specific area that's comfortable, which means that the area that would probably needs the most help with removal of plaque is continuing to simmer, I guess. So to give you an idea of some products that sort of describe passive oral hygiene versus active oral hygiene, we're just going to go through what we do at the shelter. So at the shelter, both our shelter patients as well as our privately owned patients get when they get a dental assessment, once they had some sort of dental procedure, or sometimes if we feel like they would benefit from a home care pack, we'll get sent home with these products. So I think we're going to be talking about dogs first. Yes, we are. So for dogs, when we send our patients home with a dental pack, they get a sample of TD. So TD is a prescription dental diet, and in terms of the studies behind this product, it does significantly help reduce both levels of plaque as well as tartar or calculus. It falls into our passive oral hygiene. So obviously your pet would have to chew this properly to gain benefits from it. Another product that our home care pack includes is something called Orovet. So this is similar to your Dentastix, Greenies. There's quite a few dental chews on the market. I personally like the Orovet dental chew. It is a little bit more expensive, but in terms of the studies behind it, I feel like it has the most evidence to support its use. So as well as it being a chew product, it's got a active ingredient in there that's almost like a mouthwash, like an antiseptic. So as they chew, they obviously the chew helps brush their teeth, but also releases the antiseptic that helps reduce, like actually kill some of the bacteria that's present in the plaque. So they're the passive products. So what I normally tell my clients is, once they've had their procedure, or they're starting, for example, for our shelter patients, adopted owners would go home, and obviously they don't have that bond yet. We wouldn't be like, oh, go home and start brushing your new dog's tooth. No. So we would say, start with your passive oral hygiene first, get comfortable, get used to maybe just lifting up the mouth, and then see if we can work our way towards these products here. So this here is a little microfiber little finger toothbrush. So it's softer than obviously a standard toothbrush. So in terms of getting our pets used to having their mouth handled and having things put in their mouths, these are the products that I find helps get them used to it the most. Now, this one comes with a little, we send you home with a little toothpaste as well. This specific toothpaste, so any toothpaste is not appropriate. You need to get a pet friendly toothpaste because they can't spit the way we can. And so you can run the risk of getting an upset stomach if you use human toothpaste. I specifically like the Pedisan brand because, one, it's chicken flavored. So in terms of compliance, they are more willing to accept the finger toothbrush because it tastes like chicken, but make sure that you don't get bitten in the process. So this is a very slow process, and you want to take it step by step. And I guess they do claim that it stops the plaque from calcifying. So this toothpaste, if used regularly, can reduce the layers of tartar. So not plaque, but by having the toothpaste in the mouth, it can reduce that plaque from turning into tartar. I don't know if there's really sort of significant evidence behind it, but that's just what they claim. So this here is an alternate. So they both of these products are included, but some pets would prefer the microfiber toothbrush, and some may prefer this product here. So this is MaxiGuard wipes. So MaxiGuard wipes are really thin, almost like little makeup pad remover little wipes. They are coated in zinc and vitamin C, which are that have antiseptic properties, and they have next to no taste whatsoever. So because it is very soft and very thin, I find for some dogs that the microfiber toothbrush might be too thick. It might help introduce the fingers more safely into the mouth with MaxiGuard. So they're the sort of products that we supply, but all of this is really just to sort of get our pets used to eventually taking a toothbrush, because what the studies have shown is that your brushing, which is why as humans we brush our teeth every day. We don't just rely on eating an apple and hoping all our plaque goes away. We brush our teeth because it is the most effective way at removing plaque. I guess in terms of the evidence, for brushing to be effective, it does need to be done at a minimum of 3 times a week, but ideally daily. But as I was saying before, even if we can't brush their teeth 3 times a week or once a day, you do have those increased other benefits, like just increased awareness and increased bond and those sort of things, even if you can't do the primary goal of brushing their teeth. So there's something to keep in mind. Let's go to our cats. So similar to our dogs, we've got our TD. So this is, they're both for dogs and cats. It's a fully balanced diet. I can say personally, my cat's on TD, and I like the product. I find it's very palatable, and I can understand our cats are definitely a lot harder to accept the toothbrush than our dogs. So having them on a good dental dry food can significantly reduce the stress associated with brushing. I guess in terms of passive oral hygiene, we include some greenies in there. I guess it does have a veterinary oral health council approval, which means that there is some evidence behind the use of it that removes plaque. But I guess personally, when I give my cat a greenie, she bites it in half and then swallows it whole. So again, like I was saying, with your passive products, they need to chew it for it to be effective. And if I remember correctly, the chewing has to persist for a good few minutes for it to be effective. So that's where the diet's really good, because they're going to be crunching on the food for at least a few minutes, I would hope. So in terms of effectivity, your dental dry food is going to be a lot more effective than your greenies for cats. But being an avid cat lover, I couldn't not include some sort of cat treat in our dental packs when the dogs get dental chews. So I guess you would have to feed quite a few greenies for it to really be effective. But I guess if you do have a cat that does munch on a greenie for, a few minutes, might be effective, but I wouldn't say that's going to be your be all end all in removing plaque. And then same as our dogs, they get sent home with the finger toothbrush and the wipes. I tend to find that a lot of my clients tell me that the wipes are a lot more acceptable than the toothbrush. So that's always good for everyone to be aware, just because it's tasteless. So they might, I guess maybe the chicken in the toothpaste isn't as tasty. I don't know. I haven't tasted it. So I guess if we were considering starting out your cat on some sort of active oral hygiene, I would say your wipes would probably be your best bet. Okay, so let's go into some common myths and misconceptions about how to do oral hygiene, or why oral hygiene and that sort of thing. So first thing, that this is something that I get a lot of my clients telling me. So I don't think we should be, or a client would come and go, oh, I feed my dog bones, so that's what I do to help their oral hygiene. So in terms of the evidence behind feeding bones, so bones used to be quite recommended for oral hygiene a little while ago, but there has been some studies that compare the oral health of wild dogs that get predominantly, a bone or carcass-based diet versus our domestic dogs that get, a combination of commercial dry and wet food. In terms of what the studies were looking, there was no difference in the amount of plaque, specifically plaque, between our wild dogs and domestic dogs. So they had the same degree of periodontal disease. So when we're talking about bone loss and attachment loss under the gums, there was similar amounts of periodontal disease in our wild dogs that were fed carcasses compared to domestic dogs. So I guess what that study was trying to say is that even though they may have looked like they had cleaner teeth, so they had less tartar. So our wild dogs definitely had less tartar on their teeth, but it didn't stop them from developing the same degree of periodontal disease. As well as that, with bones, you've always got what we call a zoonotic risk. So if the bone wasn't prepared properly, or if your dog buried it and then grabbed it out again and it's got some salmonella or bad bacteria growing on it, and then you were to accidentally handle the bone, there's always the risk of transmission of nasty bacteria from the bone to you, and then your health being at risk. As well as that, gastro risk. So some dogs, if they were to eat too much of a bone, they can get, you know, life-threatening conditions like pancreatitis. Their pancreas can get inflamed. They can also just develop gastro. I've had many dogs develop constipation after eating bones. And the other thing that the study had found was fractured teeth. So dogs chew on these bones so hard that they end up breaking their teeth. And when you've got broken teeth, you've got, you know, pulp exposure. So the nerve endings of your teeth become exposed, and that can cause a significant amount of pain. So personally, I don't recommend feeding bones, especially if you're only doing it to improve their oral hygiene, because there's no evidence to suggest that it actually helps their teeth. In fact, it may actually put them more at risk at having a painful mouth. The other thing that a lot of clients tell me is that it's, you know, that we don't need to do oral hygiene because they are still eating. So one thing to be really aware of is food is the way to live. So dogs and cats will continue to eat and continue to eat quite well. So show no signs of pain, even if they have severe disease in their mouth. I've had a dog come in that had, you know, 3/4 of their mouth ulcerated because of a nasty cancer, and that dog was still eating. So like there was no drop in appetite whatsoever. So because your will to live is so strong, you're going to continue to eat. So there's oral appetite or drop in appetite is not associated with oral pain. So that's something to really be mindful of. They already get fed dry food. So if I guess any dry food doesn't generally reduce the amount of plaque in their mouths. That's because you've got many dogs and cats that will either, you know, swallow the pieces of kibble, or potentially, you know, the pieces are so small that they break instantly, and then there's no sort of brushing action. So just because you're feeding your pets dry food doesn't mean, that they are getting an appropriate level of oral hygiene. Next thing, I have tried brushing, but they hate it. So I've had quite a few people tell me this. I would say most dogs, I know cats again are a bit of a different kettle of fish. With dogs, generally they do tolerate brushing quite well once their mouth is not painful. So if you have tried brushing your pet's teeth and they absolutely hate it, I would definitely recommend getting a dental check done, just to make sure that there isn't actually a source of pain before you start them on the right foot with brushing. This last part really resonates close to home for me. So I have someone that can clean their teeth without anesthesia. So we're talking anesthesia-free dentistry. So what anesthesia-free dentistry is you generally have someone that is not a vet. They may claim to be a vet, but they are not a qualified vet. Remove tartar from the crowns of the teeth. So to bring that point closer, we've got, you may have remembered this picture from a couple of slides ago. So if you look to the left, this is a dog that I saw a few months back now. And you can see this is what the mouth looked like before. And this is what the mouth looked like after I had finished. If you'll notice, this tooth here and this tooth here are missing. But if you look at this before photo, there's nothing obvious that you see there that tells you that that tooth was infected and that this tooth had severe attachment loss. They look exactly the same as every other tooth. What told me that this tooth needed to come out and this tooth needed to come out was actually probing. So we probe these teeth around and see how much attachment loss there is. And also we x-ray the mouths to actually see what the roots are looking like. Is there bone loss? How much bone loss? And that's when the decision is made whether or not a tooth needs to be extracted. So if this dog had gone and gotten anesthesia-free dentistry, all of this tartar may have been removed, but the infection that's actually causing pain and discomfort is residing up in the gum, away from where any hand instrument's going to get to. And the other thing that happens is that they hand scale the teeth, but they don't polish it afterwards. So when you remove tartar and remove plaque infection from the teeth, you create little roughened surfaces on the tooth. And then if you don't go back and polish it afterwards, almost like when you polish your nails, making them all shiny, you're going to actually allow more plaque to stick on afterwards. So anesthesia-free dentistry is a cosmetic procedure, has no benefits in terms of removal of pain and removal of infection. So if you speak to any of your friends and they have said, you know, I've got my dog's teeth cleaned by someone without anesthesia, please tell them that they're not doing their pet any favors whatsoever, because the infection and the pain that we're worried about lives under the gums. And if we're not treating under the gums, we're not doing anything for our pets. So that comes to, I think, the conclusion. So this is a little video just to end our presentation here, just to show you that I do actually practice what I preach. So hopefully this loads. So this is my dog. Oh, geez. So this is my dog, and I brush her teeth every day. So she has graduated from a manual toothbrush to a electric toothbrush. So she's 12 now, and I started brushing her teeth when she was 4 with a manual toothbrush, and it took me about 8 years, or no, 4 years to get upgrade from a manual toothbrush to a electric toothbrush. So really helps save my hand work. So I hope you have enjoyed my presentation, and I hope you've got a little bit more knowledge about, you know, why we recommend doing certain things, because at the end of the day, all I want is for all our pets to have a pain-free and comfortable mouth. So with that, I will end, and I'm open to any questions you may have. So, oh, hello. Okay, maybe I go through the chat. Where are we? Okay. So first one from Beautiful Color. I don't think that's a question, but thank you for the comment. So from Marie, just wondering if you consider or recommend water additives for dogs such as Aquadent. So Aquadent is a product that I have some knowledge about. So I guess it's it would be considered your passive oral hygiene. I'm not sure about the active ingredient behind it, but I guess one thing to note is when you've got water additives, a lot of them, if they're not actually truly antiseptic, they're almost like an odor neutralizer. So even though the mouth might smell better after use of Aquadent, it may not make much of a difference in terms of removing plaque. What I can do is I can read up more in about Aquadent and sort of maybe post like a follow-up answer on Facebook. It was very popular a few years back, but I feel like it's been superseded by more effective products. So I wouldn't sort of I personally wouldn't sort of jump on Aquadent being my be-all end-all when it comes to oral hygiene. Hopefully that answers the question. Oh, thank you. I know, especially our older patients, so one of the comments has come through, cannot imagine brushing my 11-year-old Jack Russell's teeth without losing fingers. So yes, I know it is hard to get our older patients to accept oral hygiene. I guess, you know, whatever you can do is better than nothing. I do find a lot of our older dogs, especially if they haven't had oral hygiene from a young age, do have quite significant disease and infection. So I guess, like I was saying before, might be worth making sure that there isn't any a lot of the times these small breed dogs, they can have infection and infected teeth right at the back where you can't see it until they're actually under anesthetic. And I don't know, you might find that they might be a bit more accepting of the brush afterwards. So next question. So can cats be trained to get used to teeth brushing? Yes, absolutely. Start young, preferably. So I guess I remember speaking to one of my vet colleagues who was working in the UK. So I remember some of the feedback that she was giving me was that there was a huge percentage of cat owners in the UK that were very regularly brushing their cat's teeth. So it's all about little steps and taking it slow and always making it a positive experience. So one of the little tips with cats is using a little cotton bud tip rather than a toothbrush initially. Because even your fingers might be huge inside a cat's mouth. So it's something that I'm still working towards with my cat. And what I do is I've got a cotton tip. I'll put a little bit of tuna water or something tasty on it, because at the end of the day, the toothpaste isn't the important part. It's the actual mechanical action of brushing. So whatever you can use to increase the level of how much friction you get in there is what's important. So toothpaste isn't that important, it's the actual brush. So hope that answers that question. So definitely cats can be trained. Take it slow, please don't get bitten. With one of the next questions, so how do we use the oral hygiene wipes for cats? So similar to the cotton tips. So it's a little makeup pad type, really thin wipe. You wrap it over your finger, and your finger is the part that it pretends to be the brush. So once you've got the wipe over your finger, you slowly introduce that into their mouth. You would maybe even only, you know, rub one tiny part of their tooth at a time and give them a treat. So make it a positive experience. But I guess, you know, one thing I keep reiterating on is just you've got to take it slow with the wipes. Put it over your finger and maybe just tap there at the front at the start, and then, you know, lift up the lip and do one tooth. And then, you know, after they're comfortable with that, then working towards the rest of the mouth. So that's generally how I find the best way to get them used to the actual antiseptic MaxiGuard wipes. Next question. Some say putting apple cider vinegar in water helps. What are your thoughts on this? So I guess when you've got, this is me just thinking out loud theoretically, I guess overall, I don't know of any evidence that suggests that apple cider vinegar may help with plaque infection. So I guess when you've got a flora of bacteria in the mouth, they change the pH, so the acidity or the basicness of the tissues in the mouth. So I guess the theory behind apple cider vinegar would be to neutralize the infection in the mouth. So I guess it might not do anything, but it's definitely not going to harm. But again, it's not something that I would put my money on. I would say you're better off trying to introduce some sort of true evidence-based antiseptic wipe. But I can see the theory behind potentially using apple cider vinegar, but I don't know of any evidence that is backing that. So next question. My pet doesn't like my pet doesn't look like it's in pain, but what are some of the signs I should be looking for? Amazing information. Thank you. Oh, thank you for the feedback. So in terms of oral pain, it's very insidious. So in terms of a personal story, so I knew very little about oral hygiene before my dog was affected. So my dog that you just saw the video of, so she I used to feed her bones because I didn't know any better, and she broke her tooth on one of the bones, and she obviously needed treatment. So it was one of the big teeth at the back, and she got that tooth treated, and she was maybe 2 or 3 at the time, and I was amazed at how her demeanor changed after she had her tooth treated. So that was one of the biggest passions drivers for me as well, was if I as a vet couldn't tell that my dog was in pain until she was out of pain, how is anyone else, you know, as a standard member of public supposed to know that they are in pain? So it's very insidious. When pain becomes really severe, things that you might notice are that they are dropping food from their mouth. So they'll pick up the food, and as they try and chew, they'll just let go and drop it again. You might notice that they're chewing on one side of the mouth. You might notice them being just a bit more sleepy than normal, just wanting to lie around and just not interested in doing what they normally do. So a lot of people might think that it's actually them just getting older, you know, they're just settling, but just them being a bit quieter than normal can be, you know, a sign of pain. You can have pouring at the mouth, rubbing at the, you know, rubbing their face on furniture and things like that. And drooling, ongoing drooling can also be a sign of oral pain. But all of these signs of pains happen when the pain is quite severe. So you can still have sort of low grade just irritation that's always there without any sort of overt signs, which is why having a look in their mouths and noticing that there is a tooth broken, or there is a tooth that looks a lot, or like the gum looks red in one specific area. So just looking in their mouths can definitely help, you know that there could potentially be a source of pain. So really good question. Next question. Oh, I'm so happy. There's so many questions. Okay, so my cat is nearly 2 years old. Is it possible to start training her for oral examination and brushing? Absolutely, absolutely. Take it slow. I keep saying that. So every cat is different, and whether they're food motivated, play motivated, you might find that a certain time of the day is more achievable than others. So definitely don't try it when they're in their crazy zoomies mode, when they're, you know, got the pupils dilated and the ears back. You definitely don't want to try and brush their teeth then. But, you know, maybe when they're, you know, sleeping, or you know, you can almost make the association. If you're brushing their coat, you start maybe just rubbing the outside of their mouths and making it a good experience, and then gently lifting the lip up and leaving it there. You know, sort of look at their feedback, look at how they are responding to you. You know, are they saying that they don't want this? Then, you know, you just give them a break, you know, try something else. Unfortunately, every cat's different. When there is some cats, regardless of what you do, you're never going to be able to get there, which is where, you know, potentially it might have to be that they need to get their teeth checked by a vet every 6 months, you know, who I've just, there's too many variables, but definitely as an overall, you are going to at least give it a go. Your 2-year-old cat has just as much chance to be able to accept an oral examination. Just make sure that there isn't any pain in there already. So if you're trying and finding that they're really, really hating it, make sure that you've at your next health check, get your vet to examine as well, and just make sure that there isn't any signs of pain that are going to impact you being able to look inside their mouths. So next question. Do you sell the other products at the shelter vet? So I'm not sure which other products you are referring to, Marie, as in, I guess, other products besides what's actually in the dental pack. Is that what you meant? Or the kits, the 4 products? Yes. So we do have, even if you don't have a dental procedure or adopt an animal, we do sell those home care packs, and I've got some step-by-step instructions as well on, you know, how you can go about introducing your pet to brushing. So we do sell those. We sell the little kit there. Next question. Have you heard of TropiClean teeth cleaning gel? No, unfortunately, I haven't. I'm going to write this down. So I was going to look up Aquadent, and then I'll look up TropiClean teeth cleaning gel. I will look into these products and give you my review on them. Again, there is so many products on the market, and they'd all market it as you know, being good for the teeth, and it's not necessarily, you know, very good evidence behind it. But I could definitely I guess it is always good to hear about more products, because there is a chance that it could be effective. So, you know, watch our Facebook page with these follow-up questions that I can't answer right now. I will endeavor to release that information to Facebook afterwards. So next question, how to help with gingivitis, redness around the gums? Yes, so literally everything that we're talking about helps reduce gingivitis. So if we can, so gingivitis is the redness around the gums is caused by plaque. So if we can remove that plaque, we can help with gingivitis. So I guess there is specific I guess cases where it's not just a standard plaque. There's other types of oral conditions that can lead to redness of the gums. And I guess, it's not, there is in those cases, just brushing their teeth might not be enough. They might need, if there is uncontrollable gingivitis, your vet may recommend actually, extraction of teeth that are associated with gingivitis if we can't get on top of it. But with your standard periodontal disease, brushing or using these products that I'm talking about, or, other products, is how you will help with gingivitis. Okay. Next question. Should I consider having my dog put under GA semi-regularly to remove plaque tartar? She has already lost 2 infected teeth following abscesses. Ouch. But regular GA concerns me. Really, really good question, Marie. So I guess when we're talking about general anesthetics, especially in our older patients, yes, our older patients are more at risk of anesthetic associated complications. But I guess there is quite a few ways we go about combating anesthetic related complications. So risks associated with anesthesia increases as the length of anesthesia increases. So if you've got a dog that needs to just have their teeth cleaned on a regular basis, a procedure for example, for a Jack Russell that only needs to have their teeth fully cleaned may only take 30 to 40 minutes under an anesthetic. However, if the same dog doesn't get anything done until they're 11 or 12 years of age, and they've got quite a few infected teeth, extractions of those teeth can take a long time. So that's why I guess, for example, at the shelter, we do what's called staged dental procedures, where we cap our anesthetic time at 3 hours. I know it probably sounds like a long time, but I have heard of many vets having to have patients under anesthetic for 6 hours and things like that. And if we compare it to our human counterparts, when you're having an extensive, I don't know, knee surgery or whatever, I've heard of medical or human surgeons having to be in surgery for 10 hours, so it's not the anesthetic that's the risk, it's the management of any complications that happen with anesthetic. And generally, well, in terms of clinic protocol, especially with our older dogs, we want to make sure that they are as healthy as they can be before they go under anesthetic, which means, your older dogs may have some degree of kidney disease or liver disease already. So it's all about managing those conditions prior to them having an anesthetic to make it as safe as possible. For example, very regularly at the shelter, we get what we call our welfare cases, where we get neglected dogs. I've personally performed anesthesia in 18, 19-year-old dogs that have severe infection. And, when we're talking to the shelter managers and I'm telling them, look, they are at a higher risk, but the degree of infection and pain that they're in, it's still, when we want our patients to live, we want them to live a pain-free life. And if we can't give them that pain-free life, then really what are we trying to achieve? So, we want good quality of life rather than them just surviving, so I do tend to digress there. So I guess in terms of, regular general anesthetics, so shorter, frequent anesthetics are better than one really, really long anesthetic. So sort of to answer your question, should you consider it? I probably would, but definitely discuss it with your vet and discuss any other, comorbidities or other disease processes that could be affecting your dog that could, you know, impact how safely your dog can go under anesthetic. So would consider it, but obviously there's quite a few variables there that still are, you know, individual specific. Great idea with the cotton bud. Thank you. Yes, I don't know where I heard that one, but it's been working great. Okay, so yes, my dog has been dropping more and more food. Yes, I definitely would recommend a dental check for your dog, Marie. Absolutely. There could be signs of oral pain. Yes, I've got a comment here. I check my cat's teeth when she's sitting on my lap. Fantastic. Next step, maybe just gently put a finger in there and just like get her used to it. And then the next time she comes, put a little bit of toothpaste or something, and then keep going. You're on the right track there, Judith. Okay. Just going through the questions. Thanks for the presentation. Thank you. I love the feedback. Excellent presentation. Thank you so much. My Kelpie dog loves to pick up a stick and chew on it. Is he doing any harm to his mouth? Yes, possibly, depending on how big or hard the stick is. So stick injuries to the mouth, you know, you can run into having splinters into the mouth as well. I remember there's a really good vet dentist in the US. I think his name's Dr. Fraser Hale. He has a really good saying that I love telling my clients. So he says, if it's too hard, if you don't want to be knocked on your knee with it, it's too hard to feed to your dog. So if you don't want to be hit in the knee with that stick that your dog's playing with, don't feed it to them. So I guess pretty much especially with Kelpies and those really big chewers, you might not notice it initially, but you could, as they start chewing, you can actually cause what's called micro breaks to the teeth, and so the teeth actually weaken over time, and with the chewing, it gets to a point where there's too much pressure and then it just snaps. So I would be careful with the type of sticks that your Kelpie is chewing on. Next question, how long can prescription dental dry food be given to your pet? Can non-prescription dental dry food be given as well? So the prescription dental dry food that I had specifically shown in the presentation is a fully balanced diet. So as long as they don't have any other, you know, health conditions, so obviously not recommended for any cats that have kidney disease or, you know, dogs with really sensitive stomachs. But if you want just a standard, if your dog or cat doesn't have any other health conditions that need to be managed with diet, they can be fed the dental dry food as their sole diet long term without any issues. In terms of non-prescription dental dry food, yes, absolutely. You can absolutely feed non-prescription dental dry food as well. I guess in terms of the evidence behind the non-prescription ones, it's not as good because the prescription dental dry food have additional ingredients in there that help both chemically as well as mechanically break down plaque, where generally your non-prescription dental dry food doesn't. But it all depends on your pet's risk to developing plaque. So you can have dogs that are on a non-prescription dental dry food and their mouth is absolutely perfect. So it really depends on their a case-by-case basis. So if you're feeding your pet a non-prescription dental dry food, but then, you know, you look in their mouth and there's no redness to the gums and there's no gingivitis, then you would be fairly comfortable to say that everything's okay and that non-prescription dental dry food's more than enough. But for cases that tend to develop more dental infection, it might be better to have almost like a stronger or like a more effective dry food. So great question there. Marie, she's got a possible heart murmur. I have definitely, not that I'm saying that there's no risk. So heart disease is something that's seen very commonly in our smaller breed dogs. And it's not something, unless they are in severe heart failure, it doesn't stop me from anesthetizing them to have their dental work done. I think my, I guess, the case that I was the most worried about was a 20-year-old. It was a dog that had a little cancer on its tail, and then also had quite severe dental disease. 20-year-old dog that had a grade 4 out of 6 heart murmur, and we staged her dental procedure. So she had 2 anesthetics about 2 to 4 weeks apart, and she's still going great, and she's living a happy life with a pain-free mouth, and that's, you know, all I could want. No worries, Marie. It's been lovely. I love all of your questions. Okay, let me just go through. Thank you. Amazing result for the 20-year-old dog. It really was, made me so proud, you know, just this is why I do what I do, because you can see at the bottom, I've said there, saving the world one mouth at a time. That was something that one of my vet colleagues told me, and I'm like, yes, that is my superpower. My superpower is saving the world one mouth at a time. So okay. Oh wow, I've definitely kept you a very long time there. So thank you so much to everyone for listening and participating and asking all the amazing questions. If you do have any more questions that you think of at the afterwards, or anything else you want to discuss, don't hesitate to get in touch. You can always send us a message through the Facebook page. Anything can be directed hopefully to directly to me. I will look up Aquadent and TropiClean teeth cleaning gel, and let you know in the next week or so what my thoughts on these 2 products are as well. So thank you again for everyone to listen and learn. And I guess my aim, I hope that I have encouraged you to start looking inside your pets' mouths, but also maybe let everyone else know what you can do to help their pets as well. So if everyone has a little bit more idea on how we can reduce periodontal disease in our pets, then, you know, I've definitely done my job. All right, well, thanks again. And I think we're signing off. Bye.